I'm Dr. Reggie Reddy, a dental practitioner. I'm here to show you there's another way to look at dentistry. And I looked at, for example, many people have gum and bone diseases. What is the traditional methodology? It's totally invasive. They'll either cut the tissue, or what they would call gingivectomies, and they'll call flap surgeries, and removing bone and cutting away gum tissue. Then I said no. I said, I did this exploration with dentine in relation to fractures of the body. I said, let me explore this. Then I began to study further about, was involved in the Hind laboratory test, HUN test, and it originated from Germany, Switzerland, Austria. And I found to measure the bacterial count. I said, if I can measure the bacterial count, that means I can reverse the so-called bactericidal effects. The bacteria, the so-called negative bacteria, releases certain amount of hyaluronic acids and other kind of acids that breaks down tissue. Then I began to treat patients holistically. So what was my approach? Right? My approach was this. Firstly is that I would do the basic dentistry of the patient, the correct examination, radiological profiling of the patient, and a treatment plan which involved non-invasive, non-aggression. I would basically have what you call closed surgery, using things like tea tree oil, using things like septolin, using ginger capsules, using turmeric capsules, right? And I would explore and remove these kinds of active bacteria in the cell. And I found that with tea tree oil, I had a superb kind of results of biomechanical irrigation on this patient. And then I would tailor make this in relation to the body's whole body health. I would work with the practitioner to make sure the patient is functioning correctly from a health perspective, whether the patient had discrepancies in their blood sugar levels or in the heart rate, lung function, liver test. I will follow this. Besides, on clinical examination and clinical medicine, from the facial area, the pH balance, from looking at the patient intraorally and looking at the tissues and the texture of the tissue, the color of the tissues, I began to measure all these things. Then I realized, yes, there is another sector of my practice I could do this without being invasive. Right? Then what was there? Is there another end point? I said no. In life there's no end point. I began to explore other aspects. Then I looked at something very, very fascinating and very interesting. I always loved the principles of orthodontics. As we know, it's about moving teeth in the correct profile, in the correct position. So I began to explore what I did traditionally, what everybody else does in practice, doing what you call some removable appliances and doing some fixed bracketing and wires and elastics and all. Then I found that I was reading up the literature over and over again. I found that repeatedly they mentioned that 82.2% of cases done mechanically in orthodontics have a relapse, right? Then I said to myself, no, but there must be another way to do this without a relapse. Then I bumped into this thing called myofunctional orthodontics. What's myofunction? Myofunction relates to the muscle. But before the muscle, what do you get? You get a tissue, and then you get a cell. And the cell builds up into tissue, it builds into the muscle. Then I said, if you get the cell right, there must be something with the tissue and muscle. Then I followed some iconic people in the world that are involved in this kind of sector of research. Professor John Muse in Wales, and Cardiff, and I followed him. I looked at the work of Professor Liverini in Italy, Professor Barry Raphael in USA, and Carmen Ramirez in Canada. And I began to follow these trends of thoughts of these people and what they did. And then I said to myself, yes, there we are. There's something that I could do. So I tracked Professor John Muse and John Flutter and found it, and all these people that I mentioned already, and including Chris Farrell from Australia, and what they did. Then I said to myself, they did it myofunctionally. And I began to study this in depth. So every course that was available in the world, either physically or online or in South Africa, I attended. Eventually I found myself attended about 46 courses on orthodontics and myofunctional work over this period of about 10 years. Right? And that made me realize that I can treat people naturally holistically without a relapse. So in this journey of myofunctional appliances, that I begin to have patients where I was embarked on a detailed medical history of the patient, and then is a dental history, and then what you call is a clinical observation extraorally of the patient and intraorally. But I went further than looking at just extraoral myofascial exam of the patient. I began to look at the patient as a whole body system. And fascinating what I found that in this patients that came to me for myofunctional treatment, there was a few common trends there. Firstly, majority of the patients were mouth breathers. The secondly is that most of the patients had discrepancies in the pH imbalance. Thirdly, they had discrepancies in their skeletal patterns. Let me explain that. So when the patient walks into the surgery, I look at the patient, I look at what we call the gait of the patient physically. And then I found the patient's posture was incorrect. Then I would put them on the chair, I'll show the patient where the two shoulders are, the discrepancies, right? Then I show them further where the two knee joints are, where the two ankle joints. So I found that they had skeletal discrepancies. Then I begin to relate that principle in relation to mouth breathing. That's one physical aspect. Then the second aspect of the mouth breathing, what I found that the pH imbalance related to the carbon dioxide retention more than oxygen. And that was what was the exciting part. Then when I began to research it, I found that what does increased carbon dioxide retention does? I found that it affects the sodium-potassium balance in your heart rate. And when that happened, I found it fascinating further that the alveoli in your lungs need to open every 1.5 seconds, open up 3.5 seconds in mouth breathers, right? And I said to myself, what happens to this pressure of mouth breathing? Then I began to analyze this pressure of mouth breathing in the patients. So I found that the 4 discrepancies which is highlighted by the leading expert in myofunctional treatment that I mentioned earlier in my talk by Professor Bailey Raphael and Kerman Ramirez and Professor Liverini and Chris Farrell, that the lip position was outward, the tongue was downwards, and the swallowing backwards and the breathing to the mouth. But then I began to explore this, that if they breathe to the mouth, what happens to this pressure? Then I began to do some analytical aspects of looking at the pressure of build-up in the mouth. Then I found that 65% of the pressure that builds up in the mouth creates downward pressure on the tongue. And that creates pressure towards, push the tongue back on the pharyngeal opening. And that creates suffocation. The patient from being so-called, breathlessness, the tongue has to go somewhere. The tongue has to go outwards. That pushes the teeth and the jaw, upper jaw downwards and forwards. And I was fascinated by that. But what is in addition to that I found that some of the pressure that exerts in the mouth, 35% of the pressure exerts through the sinuses. And that pressure leads to the part of least resistance, what you call the part of the middle nasal concha. And that goes towards the sinuses, goes to the eustachian tube, the bioengineering valve opens up and comes back and flattens the face, right? And so I found this wonderful clinical features, and then affecting the little artery that's adjacent to the optic nerve. There is a small little artery that next to the optic nerve, and that blood vessel stops in that place, and then over a microscopic period of time, and that causes a black shadow. In addition to that intra artery there next to the optic nerve creates pressure on the intraoptical muscle next to it, and thus pulls your pupil diverse away, and then away from the central focal force of the eye, right? Which cause divergent lenses, and pull your rectus muscle away from your eye, right? So this is what I found clinical features. But in addition to the whole thing, I found the patient's skin changes to a dryness of the skin because the pH imbalances, because of the acid nature, right? So the pliability of the tissues changes, right? The cell, the tissue, and the muscle. So I told myself, if I get that pliability of the muscles relaxed, I'm able to get the muscles and the tissues and the cell to react correctly. So based on what principle? It's based on the principle of creation. The first thing in birth and creation that we see is the soft tissue, then the hard tissue. It's called function and form. So if you get the soft tissue right, the hard tissue, what's the hard tissue? It is the teeth and it's the bony structure, right? So hard tissue will follow. So I begin to engineer this integrated philosophy of treating patients now less and less with wires and elastics, and more with my functional appliances. And one of the main appliances that I use is the my brace appliances, right? And besides certain other appliances that I may use, right, called the Frankel appliances, and designed specifically that which I developed with one of the laboratories in Johannesburg, you know, and to function, so we get the function correct in terms of the lip position, tongue position, swallowing, and the breathing, right? So this created an impact to say that how can I treat this patient holistically? But I found there was something else that I needed to get this integrated process correct. One was get the diet right. Let's explain the diet, right? The diet in relation to the pH imbalance, to ensure that the diet is more alkaline than acidic. The 5 principles in diet are reduced, namely rice, what you call is normal traditional white or brown rice, bread, pastas, pizzas and potatoes. And I replaced it with a fascinating thing: unpolished brown rice, brown basmati rice, rye bread, lentil pastas, banting pizzas, and sweet potatoes. All these kinds of things positively affects the pH from an acidic to an alkaline state. Then I introduced something called sound therapy. Sound therapy, I introduced somebody to play one of the so-called mouth instruments, the flute, the recorder, penny whistle, the saxophone, or the trumpet. So what happens in this process? Automatically the lips go in, the tongue goes in the right correct position, the swallow correct, and the breathe to the nose. Then the third thing is the swimming technique. What is swimming got to do with myofascial treatment orthodontics? So I found that what does swimming do? Get the posture right, get the body perpendicular force of gravity. Like they do a backstroke, they do a freestyle and butterfly. So they find that they're able to stretch the vertebra in the spinal column that was compressed because of bad posture. And the third thing is that when you do the butterfly, it improves the core muscles and get your breathing technique right in terms of your biorhythm, right? And the fourth thing is the breathing, which is key, the alternative nostril breathing, which is absolutely critical in my program. So I found that what does the breathing does? Increase oxygenation and decrease the carbon dioxide. But in this process, I found that the children that are coming to me were often average students of D's and E students, and most of them were mouth breathers. The moms told me about that problem of concentration, and some of them were on Ritalin and Concerta, and said to me, but you know, doctor, they were at school and they were classified as ADD, ADHD, and we accepted it. I said, Mom, why are you accepting it? She said, no, this is what I was told by most of the practitioners, most of the therapists at school, and that's the reason we agreed. Okay, are you willing to try this program? I said, I'll get the teeth right, I'll get the muscles right, the pH, but I said the most important thing, I'll get your child to improve at school from a normal child on D's and E's to A's and B's. And the testimony is that I've got many of my patients who are not only average students and now excel in the career, in terms of whether they're in school, whether they are in early university's career, right? Now, what happened to those patients I spoke about, 82.2% of cases that are relapse? Am I seeing them? Am I not seeing them? Yes. How do they become attracted to me? They become attracted to me because they are the parents of children who are coming to me for now this integrated approach of myofunctional treatment, and they said to me, but oh doctor, but you know what, I had orthodontics, I had a relapse from the treatment, now I realize that what you said is absolutely true and relevant. Are you able to treat me? I'm willing to go to the process. So many of the moms and dads, I'm treating now the relapses using myofunctional treatment, right? But what is the difference in children and adults? In the adults treatment, everything is twice as more intensive as for the children. And a wonderful testimony I got, right? My youngest child is 5, my oldest is 42. 27-year-olds to 37 and 42-year-olds have had relapses in orthodontics, right? And through this process, the adult patients tell me they begin to sleep better, they begin to feel better, and most important thing, the teeth are getting into place. So in this journey of beginning to sleep better, I bumped into another aspect of what I'm doing is on disordered sleep therapy, what they call sleep breathing disordered challenges. So when they have the sleep breathing disordered challenges, that means that because of mouth breathing, they don't sleep properly, right? And then I begin to realize that they have sleep apnea. Then they are often on machines, in sleep apnea machines and artificial things, and they have to have this every night when they sleep. So I said to my mom and dad, are you willing to try this treatment on mindfulness? They said, I'm willing to try it, and if it works, I'll be happy to go on the journey. So I introduced the myfunctional appliances, and they followed the diet program, the sound therapy, they followed the breathing exercises, and they followed the diet program. And as a result, the adults, we're getting fascinating results. To say that we're not only fixing up the relapse in the teeth, but also fixing up the sleep apnea.